Hi there, and welcome to another episode of CLS Live, a live stream series presented by the publishers of Contact Lens Spectrum. My name is Lyndon Jones, and it's great to be here chatting to some of my friends and colleagues from around the world on the future of contact lenses. In each of these next three programs, I'm going to be discussing the challenges and the opportunities for industry, researchers, and clinicians to optimize the performance of lenses that we have today, and also what the future holds for contact lenses. Now, today, I fortunately get to welcome a great friend and colleague of mine, Professor James Wolfson. James is a UK-trained optometrist who's currently Professor of Optometry at Aston University, is the former Deputy Executive Dean for Life Sciences and Associate Pro Vice Chancellor at Aston, and is the current head of the School of Optometry and also head, unusually, of the Department of Audiology at Aston. Now, prior to his appointment at Aston, he was a clinical research fellow at the University of Melbourne in Australia, following his optometry degree at the University of Manchester, followed by a PhD at Cardiff University. Clearly, someone who never really wanted to stop having to be at university, James, by the look of it. His main research interests are in the area of development and evaluation of ophthalmic instrumentation, myopia management, contact lenses, intraocular lens, and the tearfil. He's got a very storied past. He's a current national teaching fellow in the UK. He's published more than 300 peer-reviewed papers and presented at conferences all over the world. I'm sure many of you watching have seen him present. He's the current academic chair of the British Contact Lens Association, having previously been its president, and was chair of the BCLA Contact Lens Evidence-Based Academic Reports. He's on the executive of TFOS, the Tearfil Monocular Surface Society, and was a harmonizer and subcommittee chair for TFOS DEWS 2, notably being the first author of the diagnostic paper, and also was very heavily involved in the more recent TFOS lifestyle reports. He is the International Myopia Institute's chief scientific officer and was joint chair of their white papers. He also holds two very prestigious recent awards, the BCLA Medal from 2021 and the American Academy of Optometry Glenn Fry Award last year in 2022. James, welcome, and thanks so much for being here today to start us on this series about the future of contact lenses. Now, in this particular episode, we're going to be discussing the extremely important issue of contact lens comfort.
Thank you so much, Lyndon. You make me sound as if I'm very busy.
I know you are. I know you are now, and I know you have been in the past. Just the number of committees that you have been on and are today. Now, James, when we think about this issue of contact lens comfort, my mind kind of breaks this concept up really into two different areas. Firstly, I think we can start chatting about the options clinicians have available today to optimize comfort. And then we can move on and consider some of the things that companies or researchers are working on that could be relevant to this aspect of contact lens comfort for the near and maybe even the far future. So James, let's begin by looking at this impact of comfort on contact lens success. We know that contact lens penetration rates actually remain pretty low globally compared with the numbers of people who wear spectacles as their prime vision correction. So what do we know about this impact of discomfort or indeed contact lens comfort on contact lens success? What do we know?
But when we think about dropout, of course, comfort's going to be a major part of that. But we're interested when we're fitting someone with lenses of making sure that they've got good physiology, so that immediate effect on the eye, but also the prevention of future complications. Vision, of course, is a factor, and for many people also protection of that ocular surface. But comfort, we know from studies, is that real sort of main driver of something that's critical to their contact lens wear. There are lots of other benefits of lens wear, but we're not going to stand that if our eyes aren't comfortable. So there have been a series of experienced wearer studies, mainly evaluated by a questionnaire, either on the web or something that they filled in by paper. And there's been a chart review as well, sort of going back in time, looking at participants and which ones have dropped out of lens wear. And we see from that the main driver of dropout is from discomfort. So in those studies, about 17 to 50% of people drop out of lens wear, which is really why, despite our best efforts of getting more people into lens wear, that market isn't necessarily growing. But if we break that down, about 41 to 64% of people who have dropped out report that was due to discomfort or dryness. And in comparison, the sort of next biggest is vision, and that's anything from 0 to 18%. And it tends to be more in the presbyopes, as we might expect. So comfort is still a major driver for those dropouts. Now, it's also been looked at more recently in terms of neophytes. So if we're putting into people into lenses for the first time, there was a great study by Anna Sully and Graham Young and their team. And they looked again at, if we follow people over time, how many people drop out over a year, and they found 25%. So even with modern lenses, still 25%. Wow. Slightly higher if it's multifocal, that was more towards 50%. But what was really interesting there, that the majority of those 25% dropped out in the first month and 47% within 60 days. So there's a really important piece there about working with the individual, the patient, to understand that there might be things that are not so comfortable, but these are things that we can potentially work on with them. And there were various factors they looked at, but it does seem to be individual practice driven. So it's not perhaps just the discomfort per se, it's about how that's managed, the expectations perhaps, and how we enhance materials and what they do with the lenses to make sure that they are comfortable. And also that same group, so Graham Young's group, has looked in the past at taking those people who have discontinued in the past and trying to get them back into lens wear, and shown that with I think it was 77%, they could be successfully refitted. And some of that was about optimizing vision, but obviously comfort is a big driving factor in that as well.
Wow, that's some great stats there, James. So just to confirm then, so in experienced wearers, it looks like comfort is the #1 driver to keeping people in lenses. But maybe for neophytes, we need to remember that vision and handling as being critical to keep those anyway. So how can we do that? So as a clinician, you fitted a new patient with lenses, everything seems to be okay. Is there a kind of a follow-up that we need to do early on? Because I think those papers seem to show that the dropout for kind of vision and handling was really quite quick.
Yeah, very quick. So people have suggested things like a buddy system. So someone, maybe perhaps the person who taught them to actually put the lenses in and out, to give them a phone call, a couple of weeks, maybe a month after fitting, to check how they're getting on. Because again, if you're struggling with getting a lens in and out, you might not want to go back to the practice. You might feel a bit embarrassed that you haven't got that skill set, but actually someone coming alongside you and helping you with that. But also, if you're not finding the lenses comfortable, then actually going through the sort of hygiene factors, maybe bring them back to the practice to try a different type of lens. But the other thing I think we learned from those neophyte studies, that the patient is doing this largely because of vision. So if we're compromising on vision, so if we're not fitting them with a toric lens, for example, if they're astigmatic, or if we haven't really optimized their multifocal, then they're more likely to drop out. So again, using that time to optimize. And one thing we do know about discomfort is if the people are seeing poorly through their lenses, they will report a higher level of discomfort. So while we're reporting it down to discomfort, when we report it, while we're reporting as a comfort sign, actually that's to do with our overall experience of the lenses. So if we get good vision, we'll probably tolerate a little bit less comfort than we would do if we're not getting the vision out of it.
Oh, that's a great insight, James. That's a great insight. So buddy system and making sure that vision's optimized can really have an impact on that early success. Now if we turn to these patients who are more experienced, where, as you said, very definitely #1 dropout reason is contact lens discomfort. When we think about the opportunities of the lens materials that we have available today, what evidence do we have about the kind of various properties and different options that clinicians have to fit lenses available today? That can we look at trying to optimize that comfort? What do we know about that?
So this is something that you published on, interestingly. So back in 2013, the TFOS paper on contact lens discomfort looked at things like materials, with over 359 references, I'm told. But that really looked at things like bulk properties, so things like water content, ionicity, decay, modulus, dehydration. The surface properties, so these are things like friction and lubricity, in vivo wettability, ex vivo wettability, in vivo wettability, design and fit, so diameter, centration, edge, whether it's a toric or multifocal design and tear exchange, deposits, and then wearing modality, so daily wear compared to extended wear, duration of wear, replacement frequency. And from the evidence that we have to date, there are some things that definitely don't seem to impact on comfort. So these are things like ionicity, the dK/T, modulus and stiffness, not so much, interestingly, although in some of the early stiffer sort of silicon hydrogel designs that was there. Dehydration, again, didn't seem to come out, certainly in those, although they're newer materials that suggest that this might be a thing. In vitro wettability didn't come out, tear exchange, and even deposits, although there's a caveat on that in terms of if something's active, an active protein, then it may have more of an impact. But the things that did impact on comfort is water content, so low water content went with comfort, that lubricity, that sort of lubricious surface, and this is really, I think, one of the major driving factors. If you listen to people like Greg Sawyer, the lids are dragged 600 meters a day. If you're doing that on a surface that's giving you high friction, it's going to be really uncomfortable. So there was some good work from Cole and Brennan in 2012, sort of mapping a whole range of studies and the comfort scores that people got to the lubricity of the surface. And they found that that was the thing that correlated most with comfort. And then back in 2018, we were able to do a study where we took a material and we were applied a nano coating to it that didn't change any of the bulk properties, that just changed the lubricity of the surface. And that made a significant improvement in.
Yeah, I remember reading that paper, James. That was a beautiful piece of work where I think you probably for the first time really confirmed the fact you can take an existing lens material. And I think it was the first time that anyone had actually been able to do that, take the bulk properties to be exactly the same, completely modify the surface by putting that more wettable surface on it, and you found an increase in comfort. So I think that plus the early work, because interestingly, you've mentioned that paper, the contact lens comfort paper, is now 10 years old. Yeah. And so, in the last 10 years, have anything really changed to change the results that we got from that review paper back 10 years ago?
I don't think hugely at the moment. Obviously, more innovations, and we'll talk about it later, are happening in terms of materials, but we still know things like daily wear, getting rid of the solutions is a positive thing to do in terms of comfort. End of day comfort is still an issue. There's a great paper from Eric Pappas where they look at end of day comfort with a variety of lens materials, but they benchmark it to spectacle wear at the end of the day. Yeah. And what's interesting is that there are quite a few lens materials now that are absolutely no different to an emmetrope, and actually are better than a spectacle wearer at the end of the day. Because I think we sort of forget and we play down, oh, well, contact lenses can be uncomfortable, but actually wearing spectacles all day long and having something perched on the end of your nose can also be uncomfortable. So I think contact lenses have a fantastic place, and by practitioners optimizing them, they can give people better comfort even than they would get from their spectacle correction. So that to me is quite new.
Yeah, that's a really nice takeaway from that section, actually, James. So dK/T doesn't impact comfort. So if you think that by improving comfort, by moving to a lens that transmits more oxygen, that we don't have any evidence about that. But keeping surfaces wettable and making sure that interaction between the lid and the ocular surface, or the front surface of the contact lens, seems to make a difference. That's really great. Now,
yeah, and the other thing not to forget is about fit. We need to fit lenses so they don't have excessive movement and they're not too thick. Those are two things that we do know that impact on comfort. So we do need a fit that's going to have keep the eye with good physiology, because obviously complications will make the eyes uncomfortable as well. So we can't forget those sort of key aspects of clinical skill in fitting lenses.
Fantastic, great point there, James. Now I think when practitioners have patients come in who are suffering with contact lens discomfort, the kind of first thing that they'll do is one of the things you just talked about. I'm maybe going to change the lens material. I'm going to change the frequency of replacement. There is evidence out there that that will have an impact. But I think we tend to forget it may be the patient. Now, you know, when we look at the patients in terms of what their ocular surface looks like, do we have any evidence about out there that maybe one of the things we're missing is trying to optimize the environment in which that lens is being placed? What evidence do we have about the fact that that can impact contact lens success?
The answer is lots. So there are studies with the original HEMA materials, there are studies now with the old silicone hydrogels and the new silicone hydrogels that show if you have someone with a poor ocular surface stroke tear film to start off with, they are much more likely to drop out. So that whole managing their ocular surface, so thinking about things like blinking, meibomian gland optimization, lid hygiene, all of those things are going to make their general wear more comfortable, and evidence shows that they're then more likely not to drop out of lens wear. So that management of the anterior eye prior to lens fitting is really important.
So really just looking at a patient as if, you know, just setting aside the fact they're a contact lens patient, if this were a patient with dry eye, kind of doing the same sort of management that we would do with dry eye patient, is that what you're suggesting?
Yeah, absolutely. And not just dry eye. Dry eye is symptomatic, but of course there are people with ocular surface disease that are not symptomatic, but we're going to challenge their ocular surface because we're now splitting up the tear film. You know, that contact lens, even as it's thinnest, is probably going to be at least 10 times thicker than the tear film. And as we've said already, there's that, you know, potential of friction with the lids and interaction with the lids. So we've got to be careful with those people who have some masked ocular surface disease. It hasn't translated yet into symptoms, but now we're going to push them over that border. And you can imagine for them, dropout is going to be far more likely because actually I was comfortable before, and now these lenses have made me uncomfortable. So a little bit like refractive surgery, we need to take good care, observe the ocular surface perhaps more carefully than we would do with a standard spectacle lens wearer, because there is the potential. We are challenging that ocular surface, and contact lenses are fantastic. They're so much thinner and dynamic now than they used to be, but it's still not insignificant in terms of what we're putting into the tear film.
And what about things like Demodex, blepharitis? Those can impact contact lens success as well?
Yeah, very much so. So it is about optimizing. You know, we might not make it perfect. Some ocular surface disease, most of it is chronic, but if we can improve it as much as possible before we start, the patient is likely to have a better experience. And likewise, this can't stop when they start lens wear. So it is part of the responsibility to keep them in lenses, to keep that ocular surface as good as possible.
Perfect. Now, James, you've been involved in research right throughout your career, starting with low vision, moving to contact lenses, tear film, myopia. I mean, you really have pretty much done it all. So in terms of looking into the future, with the current research that's going on, what can we expect from researchers and industry in the next 5, 10, 20 years that maybe impact contact lens success, particularly with respect to contact lens comfort? What do you see?
So I think there are various different areas that people will continue to work on. Some of this is here already or in early stages. So around sort of the biocompatibility of materials. So things like low dehydration rates, even with the lenses we have on the current market, that varies over a 20-minute period from 20 to over 40% dehydration. So that's going to have a big impact on the ocular surface. Yeah. Those coatings, things like water gradients, to really bathe the ocular surface in something that's much more like tears, while maintaining those fantastic bulk properties that we need for things like the high oxygen transmissibility. So that's one area. Drug delivery and leaching materials. Of course, we've had our internal wetting agents, PVP, hyaluronic acid, and then elution of polymers such as PVA. But there are lots of unique technologies now to aid surface wetting. And that, I think, again, is all about that lubricity and making this something that really induces no friction at all to the ocular surface. I'm very excited about the potential for a contact lens to actually be the solution for dry eyes rather than the cause. Because actually, if a lens goes over the surface and reduces the friction between the ocular surface and the lids, that would be a fantastic thing. And then the other area I think is around solutions. Of course, at the moment, we know no solutions is a good solution in terms of comfort. But again, companies are still innovating in this area to make lens wear safe, but also to optimize the actual surface of the lens. So that's another approach to sort of putting biochemical materials or a coating on is actually working on the solution. And it probably is the combination of those things that's going to move things forward.
Yeah, and you can certainly imagine, having a contact lens material that's optimized for the ocular surface, in which you put it in a solution overnight, it kind of recharges the surface of that lens, gets put into the eye, leaches out some of those comfort or wetting agents, or maybe even a re-wetting drop that goes in that's optimized to kind of re-wet that surface as it gets dry throughout the course of the day. So fantastic insight there, James. Really, really appreciate you coming on and sharing your thoughts with us today. And as we draw this episode to a close, it's clear that I think we've got much to be hopeful for about the fact that maybe, as you just said, maybe contact lenses one day can be that spectacle lens killer and actually be maybe the solution for our patients' ocular discomfort rather than being the cause. So thanks very much for that. Now, just a reminder to those of you who are viewing to look out for prior episodes of CLS Live on the Contact Lens Spectrum page on Facebook or on contactlensspectrum.com, as well as the transcripts of the show, including the one today, that are now appearing in the printed version of Contact Lens Spectrum each month. Join me next month for our conversation, this time with Doctors Loretta Schottker-Flynn from the US and Dr. Deborah Dutter from James's establishment at Aston in the UK on the future options that we have to minimize infection and inflammation with contact lenses. And that episode is going to air on Thursday, September the 21st at 1 p.m. Eastern. Thanks for joining me. Thanks, James, for your insight. Much appreciated. Bye-bye.
Pleasure.